I'm talking about the exciting topic of governance and codes of practice. So if I see you falling asleep, I'll raise my voice to make sure you wake up properly. But I think before I start on the meat of it, it's really what I'd like to do is remind you why it's necessary. I mean, my view, and this is certainly why I got into this area and hence met Deepak, was the idea of we're trying to sort of define 21st century medicine. Or certainly that's my view of it, you may differ. And I find it astonishing that we don't expect surgeons to operate in the dark, but somehow we seem to expect clinical teams, doctors, healthcare organizations to work out without the benefit of the light that reuse of data can give us. That feedback about how well we're doing, how our performance compares with others, what we can discover about things, that a lot of the time this is all the data is held in silos and isn't available. And certainly one of the areas I want to get involved in is trying to open up those silos of data, and hence projects such as EHR 4CR. But of course the thing is, rather like turning the lights on for the doctors, there are actually a lot more that needs to be done than simply pressing the switch. I mean, do we have an electrical engineer in the audience? I didn't think we would, but there's a lot of requirements that go behind it. You don't want to have bare wires lying on the floor. In fact, health and safety would say you shouldn't just have wires lying on the floor at all. And as those of you who have traveled will hopefully have all remembered to bring your adapters. So like me, you have to have an adapter to get the bizarre UK 3-pin socket into the wall. So you need to have those conventions about how you will actually make use of the electricity to generate light. So we want to use it safely, we want to use it wisely, we want to have the appropriate level of light. You've got to even have the right sort of light bulb so you have a natural light so the doctor can actually recognize the colors of the tissues he's working with. So the same thing we have in terms of the use of the data. And as a sort of brief summary of what EHR 4CR is doing, you've seen this slide before. It's about sharing data from data providers, typically hospitals at this stage, through the EHR central platform to research centers so that they can actually discover information. Initially, the scenario here is very much about the sharing of data for testing protocols for research studies, speeding that up, I think really, and there's a very good talk, it's for the whole healthcare industry, through from pharmaceuticals, through hospitals, through to patients in terms of getting drugs through more cheaply, more efficiently, more effectively, to be delivered, not only that there's just the pharmaceutical, but how it's actually delivered in practice can be improved and delivered. But as part of providing that, and we need to look at the various players that are involved, the staff, the systems that go with it. And I think that's one of the key elements here, is it's not just about the technology. We can have all the technical controls about who can access what, how the data is used, but it's actually having the organizational systems, the people systems that go with it to make an overall ecology or infrastructure that works together. So it involves a whole number of things. I'm going to skip through this slide because I'll come back to the essence of this slide later on. But the key thing, and I apologize, this may seem somewhat complex as a diagram, but the idea is, IG, by the way, I'm sorry, is an abbreviation often used in the UK for information governance. So it incorporates data protection, medical confidentiality, privacy controls, organizational controls and procedures. So it's a sort of an overarching term. But the idea of the framework is it's not just about legal controls. So it's not just about legal conformance. It's about how do you demonstrate that you're conforming? How do you make sure that you're conforming? How do you have the internal feedback and controls in this area so that you know you're doing what you said you'd do? Moreover, you can actually demonstrate to others, and this is the key bit of actually generating or proving trust, is that you can show that you are doing what you said you're doing. You're following the white line in the middle of the road, and you know how you'll do it and why you'll do it and how you can continue to do it. But it needs to, the controls need to tie through with the business model, how the world really works. It's got to be practical. And certainly there are elements here as we've worked through. I know Brecht certainly has contributed hugely in terms of making sure that we have controls, but they are practicable, and they actually help the progress of the infrastructure. So we don't stifle innovation, we support innovation, but we make sure it all happens as safely as possible. This needs to tie through with obviously the system architecture in terms of the Insight platform itself, what it can deliver, and obviously the broader operating model of how organizations, data providers or hospitals sign up, how research centers, pharmaceutical companies sign up, and how the overall system works. And we try and draw this down in a series of documents, which you'll be glad to hear I'm not taking you through detail by detail, page by page, unless for some reason, Deepak, everybody else has left for the next few days. But the key thing there is, one of the key elements we've done is the core principles, and I'll come onto those in more detail. This obviously involves a lot of the legal requirements, which Nicholas was talking about, which may change to some degree with the regulation. And in many ways, a lot of this is about providing those technical and organizational structures that are required explicitly within the new data protection regulation when it comes into force, or we hope it's still there. So the core principles are a high-level summary of what we call the standard operating rules. This is how the EHR platform will work. This is how the technology will work. This is how people will operate. This is how the organizations will control it all. Those lead down to detailed standard operating procedures. I should actually say they're more templates because it's a set of operating procedures for an organization, which may, of course, need to be tailored to how that particular organization works. It's not as though every organization is created from scratch just to suit our system, so they need to be adapted to what's already established within those organizations. These need to reflect the rules, that is, into contracts between research centers accessing the platform, between data providers providing data to the platform, to make sure everyone knows everybody else's role, what they will do, if anything goes wrong, how we cope with it, how we establish it. So it's looking for all the things that can go wrong that lawyers will always tell us we should have in a contract, but this is trying to draw out those heads of agreement that would be asking lawyers to actually put in place. And of course, all of this comes down to standard training materials and again, templates so that staff know what's happening, know what will happen, and can actually accommodate. And all of this is informed both obviously by the legal requirements and also by codes of practice. And as was touched on, the IMI code of practice for secondary use of data is a key one that feeds in here. So these are some of the broad elements that we've touched on already about the EHR4CR platform, about the way data will be handled. So I won't go through that again in detail because we've already touched on that. But our core principles are really summarized just as headlines here. You can see the image on the left. So there's a lot more detail between each of these headlines. So as a simple phrase, these really don't actually give enough detail to grasp it, which is why there's a little bit more text behind it. Obviously, data minimization is a key bit that comes out of the legal requirements. Data exchange protocols is really about what information will be surfaced by data providers to be available, to be accessed by research centers and interrogated. That all needs to be established. Security, risk management controls, which is again very much about the privacy impact assessments that will be required, making sure people understand the risks, how we cope with it, what risks we cannot actually manage and will always persist. So some of that is necessarily being open to the public and the regulators. These are things we cannot control. Ideally, we control most of them, but there will be some elements. Nothing is 100%. Working through from audit trails, ensuring appropriate use, of course, is a phrase which covers a lot of sins, but a lot of that is establishing what is appropriate use, what controls, what the hierarchy of control is, who grants permissions to others when they're revoked, and making sure that not the technical controls actually work through in practice. Things like clarity of authority covers a number of elements about making sure if there is a problem, who you contact at another organization, who can make decisions on behalf of that organization, how we manage this chain of control in terms of who grants access to whom. So that comes in another areas. We do have a principle, legal conformance. Personally, I'd like to take that one out, because that's a bit like saying, well, you've got to abide by the law. Well, you can't argue against that one. I mean, I think that's just a fact of life. But we have it in there so everyone knows that we're planning to do everything legally. But I hope that trust would do that anyway. So the main objectives of this is that we're building on the legal requirements and building it into the way we work. That we're actually providing a solid but flexible platform so that we can move forward from where we are. People can understand what it is we're going to be doing, how we're going to do it. If they want to know more, there's a level of trust that they can see. So if they doubt what we're going to do, we have the documentation to show this is what we'll do it. But we're hoping that this framework will actually can be generalized and used in other projects. So we're hoping that this work that we've done in EHR 4CR can be taken on into other projects through IHD. And that, I think, is it. But if any of you have any questions or want more detail, I'm more than happy to go through it. But I promise you it won't be several days. Anyway, thank you.